So this is a demonstration of our mixed reality patient. And the way we have this set up right now is we're actually using the physical mannequin head to track the location using the HoloLens, and we're overlaying the mannequin head with a digital scan of it so that we can add a little bit more interaction, like you can see the eyes are tracking the user around the room and just things like that. So some cool things with this is that we can actually progress any pathology dynamically from the engine, and right now we're doing that using voice commands. Progress patient. Progress patient. Reset patient. So that's sort of a basic sample of what we can do with this. We also have dialogue trees for interacting with the patient. So you can give them a variety of responses. You have to be specific with what you say, and it'll respond back to you. Hello. Hello.
Hello.
And
Hello.
he responds back. My name is Trace. I will be your student nurse.
Nice to meet you.
There we go. May I have your name and date of birth?
My name is Manny Ken, and I am 24 years old.
So you can see here that we can also use images for tracking, and this we're using to overlay patient information as if it were a wristband in a hospital. Do you have any allergies?
I am allergic to penicillin.
Which checks out according to this wristband. What happens when you take penicillin?
I break into hives.
Not good. But you can see I can switch between the image track on his wrist with the doctor's information and the physical track of the mannequin as well, without having to load different scenes, so they can both be active at the same time. And you can switch between them pretty naturally. Do you have any questions? Guess he didn't hear me. Do you have any questions?
No questions right now. Thank you.
There we go. There's also gesture interaction. So for example, if I were to look at the scar on the side of his head here and then do the air tap gesture.
That hurts.
He protests my poking his injury.
Ow, that hurts.
Like so.